Hey, this is Dr. Todd, Brennan, Health for You Podiatry. Today we have a fungal toenail that we are getting rid of. You said you heard it, what, a couple years ago?
Yeah, about 4 years ago.
Okay, and it's just never come back right. He's been trying topical products, so we decided it's no time better than now to get rid of it. So he's already numb, so I'm going to check and make sure he's numb first, and then we'll free the nail up. All right? You're going to feel pressure but no pain, okay? If you feel pain, let me know.
Okay.
Anything? No? Good. So a lot of people on our previous videos always ask about the whole tourniquet thing. I'm not a big fan of using the tourniquet, mostly because we're putting a chemical agent in there, and it's kind of a chemical burn, so I want to make sure that we do get good blood flow to the area to make sure that it heals right. That's the way I've always been doing it, and that's kind of the best results I've gotten up until this point. So you can see here with this freer, I'm basically going underneath the nail and freeing it up, and it kind of gives, so you know when you're in that plane that you want to be in. And when you kind of push up, you can kind of see the nail wiggle a little bit, all right? Next, you get this hemostat here, and you grasp it, all right? And then we pull up and twist and pop it out, okay? So you can kind of see the edges of the nail here and here, so that way you know you got the whole thing, all right? So next up, is we're going to check and make sure it's nice and clean, which it certainly feels like it. All right, no more nail underneath there. Again, you can see he doesn't really have a ton of bleeding considering no tourniquet. Even with a tourniquet, you're going to get some congestion and blood in that area. So last but not least is the chemical. So again, with the chemical, textbook-wise, usually suggests 10 seconds. Again, I've kind of fine-tuned my technique. I find if I leave it on a little bit longer than that, it actually tends to affect the patient negatively. Sometimes they get some blistering on the skin, and that can cause worse complications afterwards. So I like to do about 5 seconds, give or take. For kids, usually I'll do it a little bit quicker. You're a little outside that reference range of a child, right?
I'm still a big kid at heart.
Exactly. All right, last application here. All right. Last but not least, we're going to kind of rinse it off here a little bit with some vinegar. I can get the lid off. There we go. Clean it nice and neat. And then clean it off one more time. And then we're going to put some antibiotic ointment on here, all right? You can see the black discoloration, that's normal, that's from the chemical, all right? That will go away. You're going to change this daily, all right? Put some medication on there, and then we're going to wrap this bad boy up, all right? So what we'll do, like I said, you're going to change this daily. We'll have you back here in 2 weeks to check it, all right? If there's any problems with it, obviously, please give me a call. If not, 2 weeks, we'll check it, we'll clean it up if we need to. Hopefully by that point, you should be, good to go and feeling a lot better, okay? If you have any questions, like I said, please call, all right?
Okay.
Ibuprofen for the pain. If you guys have any questions, leave them below in the comments. If there's anything that you'd like to see, same thing, let us know. Like us on YouTube, help us get some higher subscribers as we inch up towards 70,000, which would be fantastic. Like us on Facebook, follow us on YouTube, and thanks as always for tuning in. Thanks.